Hi, I'm Lindsay Bondurant. I am the director of the Pennsylvania Ear Institute. I'm also an associate professor in the Osborne College of Audiology, and I am a pediatric audiologist.
Can you explain different parts of an exam and what different tools mean?
It all starts with a case history. So we sit down with the family and we're asking questions about what their concerns are, what kind of issues the child might be having, how they seem to respond to sound, what's their medical history, are there any high risk factors for hearing loss. And while we're doing that, we're also observing the child and seeing how they're responding to us, how they're behaving in the environment, because we're already starting to plan how we're going to evaluate the child and what the best way is to get the information. It's also really important for kids to see us interacting with their parents, because then they can see that there's nothing to be afraid of, that we're nice people, the parents can trust us, we get along, and that helps the child be calm in our environment. And after we're done with the case history, the next part of the exam we're going to get, if we can, is what's called otoscopy. We use a special tool called an otoscope, which is really just a very specialized flashlight that we use to look in people's ears. So with kids, it's important because we want to see if somebody has wax in their ear canal. We want to see that their eardrum looks nice and healthy, that it doesn't have any obvious problems, any issues like that going on. So if we can get this, that's great information to start with, but some kids are really nervous being at the doctor's office and having somebody look in their ears. So if I've gotten the impression, either directly from the parents when I ask or just from observing the child, if I get the impression that the child might be really nervous and kind of anxious about having somebody look in their ears, I'll skip that part and wait to the end. I don't want to do anything that's going to get our evaluation off on the wrong foot. The next thing I might do after I finish with otoscopy and looking at the child's ear is I often want to get a sense of how the middle ear system is working. And for that, I use a tympanometer, which is what this device is. So for tympanometry, what we're doing is we're putting a probe up to the patient's ear, we're changing the pressure in the ear canal to try to get a sense of how well the eardrum is moving. For kids, this is really important because a lot of times when kids are having trouble hearing, it might be because they have fluid in their middle ear related to ear infections. It's one of the most common reasons that kids go to the pediatrician's office and why kids get referred to us here for an audiology exam. So if I can get that information from the very beginning, it gives me a really good sense of kind of the health of that portion of the system and gives me a starting point for when I'm going to do the actual hearing evaluation, because if a child does have results that are consistent with fluid in the ears or some other middle ear problem, I know it's very likely that they're going to have some hearing loss and I need to start the test at a different level versus a child who has perfectly healthy, normal middle ear function and, no history factors that would make me think they might have hearing loss. I'm going to start at a different level for those kids too. So as a pediatric audiologist, what we're doing is we're taking all of this information, what the parent tells us during the case history portion. I'm going to start that over. As a pediatric audiologist, what we're doing is taking every piece of information that we get throughout the entire exam. So we start with the case history information that we're getting from the parent and the observation that we're doing of how the child interacts in their environment. We're taking what we see during otoscopy. Do they have a lot of wax in their ears? Do we see any signs of pathology or infection or anything like that? We're looking at how the eardrum moves, and we're taking all of that information and starting to make some predictions about what we're likely to find during the testing, and that helps us be efficient and move through the testing pretty quickly. So for me, that's one of the things I really enjoy about pediatric audiology is I'm combining the fun of being with parents and kids and making it interesting and fun, but there's also a lot of science underneath it all where I'm grabbing all of this information and processing it as I go along. So if the child is really nervous about having somebody look in their ear, sometimes I'll skip doing the tympanogram to the end, but I really try to get it before our evaluation if I can, because it gives us such good information. So after I'm done with that, then the next part is really the real reason that many families are here, which is to get the hearing evaluation done. So I take the child and usually with their parent into our sound booth that is sound treated to keep everything really quiet in there and has specialized equipment for getting an accurate hearing evaluation. But what's different about pediatrics is a lot of kids are too young to do the traditional kind of raise your hand when you hear the beep that a lot of people remember from their own hearing tests, as when they were older children or as an adult. For kids, we have to adapt all of those tests to make it more kid-friendly and kid-appropriate. So we can start doing tests in the sound booth when a kid is as young as about 6 months of age. So when they're able to sit up independently, when they're starting to be able to control their head and neck and look around for sounds, we can start doing hearing evaluations. So that's one thing a lot of people don't necessarily realize, is that we can do an actual hearing evaluation in the sound booth for a baby as young as 6 months of age. So for younger babies, we have them sitting usually in the parent's lap. We're playing some sound, looking for the child's response, and there's a little toy that lights up, or a video screen that lights up when the child looks for the sound, and that kind of rewards them for responding and kind of keeps them engaged in the task. Older kids, if they're 2.5, 3, 4 years old, we make it more of a game, which is my favorite way to test kids. It's called condition play audiometry, and it's literally, we make the whole thing a game. Every time you hear the sound, you get to do the next part of the game. You put the peg in the board, you put the ring on the stack, you throw the ball in the bucket, whatever it is, and kids that age really have a lot of fun. And when kids are having fun, I'm having fun, so we can get lots of good information that way. And then once they're a little bit older, 5, 6 years old, we can start doing the more conventional way. But again, as a pediatric audiologist, even though the testing is more the conventional way, I'm always on the lookout for things that are specific to kids, like, gosh, they're getting really wiggly in there, and I need to jump in and have a little conversation to get them back on track. We don't usually have to do as much of that with adults. They'll sit through the whole evaluation, but a 6, 7, 8-year-old kiddo needs a lot more encouragement throughout the evaluation. So there's always things that we're gathering as we do the evaluation, both the information we're getting about the child's hearing, but also, how is the child responding? How are they behaving? Are they able to stick with the whole test? And that helps us to determine, are they reliable results, or do we need to do something else to figure out what's going on with the kid? So really, when I'm getting all that information, when it's all said and done, I'm looking at the information I have and determining whether or not the child is able to respond to all of the sounds that make up speech. That's really our primary concern, is can the child hear speech clearly? Because for most of us, that's how we interact with the world, and how we communicate with the world through listening is by being able to hear the speech signal clearly. So I'm not satisfied until I know that a child can hear all of the sounds of speech clearly in both ears, and then I know that they have enough access that they should be able to develop speech and language normally and to be able to communicate appropriately. And if there's other issues there, then we can rule out hearing if I have normal responses for those things, and recommend other avenues for the parents to consider to address whatever issues their child is having. If I do identify hearing loss, and then we're doing tests to determine, is it an issue with the middle ear that we might have seen with the tympanogram I mentioned? Is it a more permanent type of hearing loss with the inner ear that might require hearing aids or something like that? So there's a lot of information we're getting, and in the world of pediatrics, we're getting it really quickly because we don't have a lot of time with kids that we can afford to waste or let go by and not be getting information, because kids don't have the attention span and the stamina that adults do. So we get all that information, we put it together, and then I come back and I go through everything with the parents to really make sure they understand what their child is hearing, what they're not hearing, what it means for their communication and development, their social skills, school, all of those things, and kind of develop a plan of action. If everything is fine, then great, we don't need to see you again. Here's what I would recommend you do next. If we are identifying a problem, then here's what the problem is, here's what it means for your child, here's what we can do, here's what the next steps are. And I really try to support the parents in that process, and also the child, to make sure that they understand the information, that they feel supported, they feel comfortable asking questions, and they know that when all is said and done, the parents have control. They are in control of this. They are piloting this ship, and I'm there to support them and give them the information they need to give their child the tools to be successful.